Chad is a ear, nose, and throat doctor in Seattle. He is a surgeon, board certified. He went to Indiana University Medical School, to one of the top residency programs in the country. He was a faculty member at Indiana University, and he's spoken extensively on a variety of issues around ear, nose, and throat surgery as it pertains to disadvantaged populations, specifically those who are hard of hearing and the deaf community. Chad is in Seattle. He has been following the rise of COVID-19 for the last several months. He has a phenomenal website, drchadruffin.com, which is a one-stop shop for all sources of information for COVID-19. And with that, I would like to invite Chad to join us and share with us his perspective on how things are going in Seattle, and also what is COVID-19 and how should we be thinking about it. So with that, let me just introduce Chad for 1 second visually, and over to you, Chad.
Howdy. Nice to meet everyone. Nice to see every former Lightboxer again. I have mine up here. So one of the things why is a surgeon talking about COVID-19? As far as myself, our ENT, ear, nose, and throat surgery is probably the highest risk of the medical specialties in medicine, because we work right in the face when we have to work with people. And in a larger sense, why does the surgeon have any expertise about COVID-19? So one of the things that's going on with the pandemic that I noticed is a lot of misinformation going over everywhere. People, even professional people, are getting into hysterics about what to do, looking for possible ways to treat COVID, how do you avoid it, all these types of questions. And with the rise of the internet and this information world, it's hard to pick out who to listen to. And I would encourage you to find one source of information and stick with it. The medical professions, one of the things about medicine is we don't only diagnose and treat people. We triage, we allocate scarce medical resources, we move people through the system. So we have a bird's eye view of what's going on, even if something is not our direct medical specialty. So as a general rule, I'm not going to comment on things that I know nothing about. I'm going to stick with things that I'm very confident about saying because either I've looked at the research myself, or I noted people who have more training in specific areas than I do. So I think it's really important that you choose where you're getting your information from in terms of medicine these days. As far as COVID-19, what is it? It's a coronavirus. What's a virus? The cool little thing about viruses is they're not actually alive. They're super small particles. The coronaviruses generally measure 120 nanometers, which is billionth of a meter. The nearest thing up that's actually alive is the smallest bacterium is probably the tuberculosis bacterium, and that's probably around 3,000 nanometers across. A human hair is around 6,000 nanometers and up. So the coronavirus is smallest by 25 times smaller than the smallest living organisms that we know. The virus is transmitted it's a respiratory virus. It's transmitted in aerosol droplets. It's not vaporized into the air and just hangs there. It hangs out in moisturized droplets that are coughed out by people when they're sick. They've also been shown to shed into the environment, even if you don't actually have an infection and if you've recovered. But I don't know that anyone knows what the significance of this shedding is. I don't think it's transmissible based on what we know. Right now, the coronavirus is probably infected about between 1% and 3% of the population. And if you get infected, most people, I believe that the number is around 50% of people, about 20% of people are asymptomatic, meaning that they will never know that they have coronavirus. About 80% of, not 80%, somewhere around 70% of people have mild or to asymptomatic disease. 15% of people will be hospitalized. Of that 15%, about 5% will be admitted to the ICU. And of those who are admitted to the ICU, about half of those will be put on a ventilator. And then if you get put on a ventilator, then odds are not good. About 85% of people die. So what is a ventilator? A ventilator is a machine that breathes for you. You have a tube down through your windpipe that goes down towards your lungs, and a machine is actually breathing for you. This occurs in the ICU setting. It does not occur in a regular hospital room. You're very, very closely monitored. An ICU, just because you're in the ICU doesn't mean you get put on a ventilator. An ICU means intensive care unit care means that I believe a patient has a reasonable risk of dying if I leave them on a floor where someone is checking on them every 4 hours. If I admit someone to the ICU, I think that they have a reasonable chance anytime soon of needing to be intubated and to be rapidly stabilized. Now, that's the general overall look of coronavirus care. A lot of people are thinking about mortality, but there's also a big word called morbidity, which is sickness. Morbidity is basically any other disease, or if you get over coronavirus, what are you left with? Meaning you don't die, but you're left with some degree of damage. So people who recover from coronavirus, like most of them have very mild disease, but it also attacks the heart and can cause cardiomyopathy, which basically means you get really tired really fast in doing basic activities. The main source of damage to patients seems to be in the lungs, and it's a form of pneumonia that progresses to a hyperinflammatory state. So viruses, respiratory viruses like coronaviruses, they don't damage people directly with infection as much as they cause the immune system to go haywire and cause all sorts of damage to the lungs and other organs. And when patients start getting into multi-organ involvement, that's when they start running into problems. Do you have any questions so far? You can put them in the chat window. I'm happy to address them as we go on. The problem with coronavirus, if you wanted to design a virus to really take down a population, and there's no indication that coronavirus is biological warfare, but if you wanted to design a virus to take down a population, this would be it. And the reason for that is it has a relatively low mortality rate. It's very high mortality, generally speaking, for medicine, but on the whole, you know, as far as things you can do, the mortality rates is not that high. Whereas like Ebola or something, the virus that causes the hemorrhagic fever, the mortality is around 70%. So the mortality is not high. The other thing is it spreads well, and it spreads asymptomatically. So you can put it through an entire population before causing a problem. And then people start getting sick, they start filling up hospitals. Other people die from other illnesses because hospitals can't effectively care for everyone. So the reason I say that coronavirus is a perfect virus for taking down a population is because it kind of gums up the political structure. So that's what you're seeing with in the news, with people wondering, what do we do about this and all. With hospitals itself, hospitals in New Orleans and New York and Atlanta, they're running out of resources to take care of patients with coronavirus, but they're also running out of resources to take care of your dad who comes in with a heart attack, or one of us really, they are running out of resources to take care of basic things. My clinic is completely shut down. I can't take care of elective things right now. I can only take care of urgent things. And in terms of where we are right now, even though it sounds very scary, you have to understand that in terms of our overall response to coronavirus, it's actually been kind of amazing, because if you look back at HIV, when HIV came back out in 1979, nobody knew what the illness was. It took about 4 years for people to figure out that HIV was, AIDS was caused by a virus called HIV. It took another 5 years to get to a test. It took another 10 years to get to having protease inhibitors. And then it took years after that to refine that treatment to turning HIV to being a chronic disease. So in coronavirus, we had a test for it within days. We had sequenced the genome. And we know where it is, where it's spread, and that sort of thing. So even though it looks like things are going terrible, in the span of treatment of human disease is actually pretty remarkable. Right now, I think probably between 1 and 3% of the population has been infected. And there are estimates that it will reach between 30 and 70% of people. So what we're trying to do right now is to prevent those 30 to 70% from spiking and getting infected all at one time and basically melting down our healthcare system. We're trying to slow down the rate of transmission so that the United States is 70% infected over the course of a year or a year and a half, and not just right now. That is one of the goals of treatment today. That's what we're calling flattening the curve. Okay, so talking about what we can do for coronavirus, there's all kinds of stuff in the news, like treatment, hydrochloroquine, AIDS drugs, all kinds of things. The basic stuff that you need to do is stay at home. That will keep you from transmitting the virus to others if you have it, and keep you from getting it if you are naive or if you've never had it. The 6 feet rule is not just for staying 6 feet away. That is, if you have to get around someone, at least stay 6 feet away from them. And I'm gonna give you an example. Like, I would really love to play tennis, but I'm not gonna go play tennis because I'm gonna pick up that ball with my hand, I'm gonna swat it, that ball is gonna go to the other court, my partner is gonna hit that ball, aerosolize any virus on it, and basically create a cloud where that my partner can get infected. And we kind of see this with the NBA. The NBA, I think, had some ridiculously high infection rate for coronavirus. And I think around 25% of the NBA was infected. So the 6 feet rule is just an emergency. Like if you're going to the grocery store doing essential functionings, wash your hands. I wash my hands when I come home. I clean my phone off when I come home. I live alone, so I don't really wash my hands. Other than that, I'm not going to infect anyone. But if you are living with someone else, you should wash your hands anytime you touch your face, anytime you go outside and come back in, wash them frequently. If you live with other people, don't share food, don't share utensils. If you live with other people, stay in your own rooms if you can. I think it's okay to sleep with someone else if you've been sleeping with them. Masks do not help. There's quite a lot of controversy going on amongst data scientists of all people, but I looked at some of the reviews for masks, and masks only work with healthcare workers, and they only really work in the setting of well-trained people with good infectious disease protocol. They do help prevent transmission from infected people to well people. but they do not help well people stay uninfected. Let's see here, looking at the questions. And then if you get sick, just call your primary care doctor. I mostly say that because you may have illnesses that could be affected by coronavirus or medications or that sort of thing, and your doctor's going to know about that. If you get sick, the most common symptoms are dry cough, fever, and shortness of breath. If you get shortness of breath, you should definitely go to the emergency room. That's the point where you need to be evaluated by a physician in person. Just the minor symptoms like sore throat, fever, flu-like symptoms, stay at home. If there is testing available in your area, and the great way to find that is go to your Department of Health website for your state. That's probably the best way to find out if you can get tested. But for the most of you, just stay home. You're going to need to stay home for at least 24 to 72 hours after your last symptom has gone away to stay uninfected. Can you bring my slide back up, Kian, please? The other thing about staying healthy, and LGBT specific issues, so you want to keep your immune system up and good. Part of that is getting good sleep, controlling stress, eating well, keeping your daily routines, managing stress and anxiety. Those are all super important to keep your immune system from getting down and depressed so you can fight off the virus. We talked about new information earlier. Make sure that you get them from reliable sources. It makes a difference. And going to questions.
Let me remind everybody in the audience, if you have a question for Dr. Chad, please type it in the chat bot at the bottom of your screen, and he will be able to read them and answer some questions for you.
Beyond what are things you can do beyond washing your hands and sheltering in place? Stay healthy, get out, get exercise, go for a run away from other people. We have this concept called prehabilitation, meaning if you're expecting to go to the hospital or you're in the middle of a pandemic and you could get sick, then staying healthy, losing a few pounds, going for a run, that will keep your body and lungs in good shape. If you smoke, stop smoking. It will save your life. Make sure your blood pressure and your other health issues are optimized. Other than that, not really anything. I would check your Department of Health, see what the current recommendations are. I wouldn't go crazy, just check them every couple of days, see if anything has changed. One of the reasons why I keep focusing people back to the Department of Health is because they are responsible for the allocation of healthcare resources in the area. They keep on top of where things are and where patients need to go if they have any concerns. So, atypical manifestation, yes, thank you. So, about 10% of people can have GI, gastrointestinal problems like diarrhea, stomach cramping. If you have that and a fever, you very well could have COVID. It's been documented. Other strange symptoms are the loss of ability to smell. That has been something that's popping up in my community, ENT care quite a bit. Again, you don't need to get tested unless it's going to change something. So if I'm a healthcare worker, I have to get tested so I can go back to taking care of patients. But if you don't have to be around people, you don't have to get tested. See what the Department of Health says in terms of getting tested if you have symptoms of COVID, GI disturbance, cough, all that stuff. One of the things that people are not getting tested is because there's not enough tests to go around. The tests are not perfect, so there's still quite a bit of protocols in place on who gets tested and when. Generally speaking, in medicine, we don't, yes, we want to test people, but the test also helps us change our behavior in some way. So, for example, if you think about it now, people don't go and get flu tested very often. It's usually if they're older or have other medical conditions. If you are young and you come down with flu, you don't need a flu test. You kind of know you have it. The same thing with COVID. You only need to get tested if it's going to change the medical management of something. For people with antibodies to COVID-19, what do we know about the risk of reinfection? I honestly don't know the answer to that. That's been going around quite a bit. I believe that it would probably follow the behavior of SARS, which is sudden acute respiratory distress syndrome, which is caused by another coronavirus that's very similar to COVID. Anti-inflammatories negatively impacting the immune system. So, good question. So I mentioned earlier that COVID can attack the heart muscle. The way that NSAIDs work, which are non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, Tylenol is not an NSAID. Celebrex is another NSAID. So all of those drugs as a class can destabilize the heart, which is why I don't recommend taking ibuprofen if you have symptoms. I would probably stick with Tylenol. So yes, hopefully there will be a test to show us when we previously had COVID. So to do that, we have to test the antibodies, which is your immune response. So for the longest time, the HIV test was an antibody-based test. We didn't directly test for HIV. Now we do. Right now, we test COVID for COVID itself, the virus. We are not testing antibodies. So we can tell if the virus is replicating in your body right now. We can't tell if you were infected with it in the past and it's no longer replicated because your immune system is taking care of it. I don't know when that test will come around. I also want to say that the natural history of this, this goes into thinking about other aspects of health, like financial health. We're going to be bunkered down for at least 2 months, probably 3. So we don't want people to all of a sudden start moving everywhere and catching COVID all over again. So you need to have a plan in place, which Mark will talk to you more about, like a 90-day plan at least. You've been at home 15 days with your partner, have never left or been exposed to anyone else. Is it safe to say at this moment we are not exposed? It's probably safe to say that you do not have the virus in your body at that moment. I can't say that you have never been exposed because this virus has been going around for quite some time. If you're a global traveler, you may have been exposed to it. So I can say that it's probably not replicating in your body right now. I can't say if that's because you don't have it or you had it and you got over it. Reliable resources. I think that the CDC is reliable. Harvard Medical School puts out a lot of information. I think you basically want to look, if you are looking for information about how long is this disease going to last, you don't want it from a CNN anchor. You want to make sure that whoever they have on CNN is an epidemiologist, an MD who has training in public health. If you are looking at, in general, you don't want a surgeon giving advice on COVID. You want people who are in public health and that type of thing on leading the airwaves and educating people. I think any of the major universities that has a medical school will be putting out accurate information. I think you just generally want to cross-check it with people who have like copious MDs in the article. The other thing, don't listen to one research article. Research is not about a one-time finding. It's no different than you're getting excited in business over one single thing. It's like, it's context, like things showing up again and again. Why aren't more people talking about AIDS? I don't know, but it does bring me up to one thing for our community. So there have been some, there's been some concerns that antiretroviral drugs used to treat HIV may provide some protection against COVID. So I would probably get a 3-month supply if you're HIV positive. Get a 3-month supply to your drugs. Call a pharmacist. Call your whoever prescribed them and say you just like to get something dispensed, like a 90-day supply. You don't have to tell them why. Just say, I'm going to be off the grid or something like that. There's a lot of stuff going on about hydroxychloroquine, and I honestly think a lot of it is probably noise. There's going to be a lot of things. There's going to be a lot of people trying different things, and this formalized process of trying different medications and treatment strategies for COVID is called a clinical trial or research. And there's different ways of evaluating research. One is just like doing very, very small, like safety trials. Another one, a next level, is doing, seeing if it's efficacious, if it works in a small batch of people. And then once you have that, you can move up to the next one, which is a widespread clinical trial. And until you get to widespread clinical trials, and usually you want multiple clinical trials, I wouldn't take something as gold. Herd immunity. To get herd immunity, you have to have about probably around 30% of people in the community infected. Once you start getting around that level of infection, then the spread of the virus slows. In some ways, it's very similar to social distancing, where you're preventing the virus from spreading physically because you're not around from someone. In herd immunity, you're preventing it immunologically because that person physically can't get infected again. And that's going to take a while to get up to, probably about a year and a half. Yes, I think people will get to an antibody-based test eventually. No, I don't think you should be spraying Lysol all over your mail and stuff. What percentage of patients?
I know there's lots of questions coming in here.
I don't know the percentage of patients who lose smell and taste. It is a minority, but it's popped up on plenty of ENTs radars in our discussion forums. The incubation period can be as long as 14 days. It very well possibly could be in terms of the Dallas conference. The point is, we can't tell if something is COVID or the flu until someone ends up in the hospital and that hospital is seeing a greater number of patients. It's hard to tell on an individual level without a test. This is regarding AIDS and why people aren't comparing this to the HIV epidemic. So a lot of the tools that we have today were not in place in the beginning of the HIV epidemic. It took many, many years to get to the rapid automation and molecular biology tools that we have today. So I don't think I think it's apples and oranges in terms of comparison. I do notice that people are talking about comorbidities, like, they got COVID, they almost died. Didn't they have comorbidities? Like this is becoming a little bit of a, scapegoat, if you will. So I do see some parallels there in scapegoating people. So Lots of stats about the virus living for days on surfaces. Just because the virus is present on something does not mean that it can infect. You have to have a certain number of virus particles be transferred to your mucous membranes to infect. And most of the doctors out there who have been talking about this say it's not necessary to worry about cardboard and Amazon deliveries. Just make sure you wash your hands if you're concerned. Open the package, get your stuff out. You can open the package, you can then wash your hands, you can then take stuff out of the package, and then you can wash your hands again if you're that concerned about it, if it makes you feel better. I don't think you need to go spraying down everything. I don't. Okay. Any other questions?
I think we have just about 3 more minutes left, and I think there are some questions still coming in.
Oh, they are? Sorry, I didn't scroll down. I think delivery food is the same thing. If you eat the virus, it is going to be killed by your digestive juices. The virus seems to be, in the vast majority of cases, a respiratory virus. I'm not quite sure where the gastrointestinal symptoms come in. So I'm not doing anything other than really washing my hands and staying well away from people. So any longer lasting? Oh, yes. Good question. So this is where I was getting to. Yes, everyone in here is going to get infected with COVID. Everyone is. The key thing is don't get infected now. You want to get infected in November or February of next year when the hospital is full, is empty, and can accommodate your sickness and treat you well. And the COVID mortality is about 0.7%. It's about almost 10 times more deadly than the flu. So in a great healthcare system that's not burdened, 0.7% of people are going to die no matter what. So when the hospital gets overburdened, that's when we start seeing mortality rates getting up to 1.5% and as high as 8% in some cases. So any longer lasting complications after COVID, even after you beat its initial effects? If you are admitted to the hospital, I think it's safe to say that you may have lingering effects afterwards. If you had just a mild infection that never requires you going to the hospital, you're probably not going to have a long-term effect. All viruses mutate all the time. It's one of the ways that we can track the progression of a virus through the community. So we can tell where, like if Keon got his virus down in LA, we can tell that the virus is subtly different than the one in Seattle. The importance comes into only in terms of if that mutation is great enough to affect diagnosis and treatment of it. And that I don't know if anyone knows that yet. Smoking is an issue with marijuana. I would not, generally speaking, I don't think that marijuana has much of a health effect on the lungs. I'm not a pulmonary doctor, but in terms of lung disease and that sort of thing, medicine generally doesn't worry too much about that. However, I probably would not smoke marijuana right now. You probably could vape it without, I wouldn't vape it. Actually, I'm not an expert enough to know in that area. I wouldn't do it at this point. There's been plenty of vapes that have resulted in like the Juul things over the last year. I think switching to edibles is perfectly fine. Kids are not immune from the virus. They just don't show over-infection from it. So they very much get infected, they very much get infected. I'm gonna guess that their rate of infection is probably the same as adults. They just don't show symptoms. They basically become carriers of COVID.
So I think that brings us to our top of the hour. I want to thank Dr. Chad Ruffin for his incredible insights. and helping us all learn about COVID-19 and all the incredible things that you are sharing with us is really appreciated. Hey, Chad, how can people get in touch with you? How can they learn more about COVID-19 and all the stuff that you've been researching?
If you want to stay on top of COVID-19, I update the page probably every couple of days. You can find that page on the front page of my website, and I'm going to put it in the...
It's chadruffinmd.com, and you can also reach out to Chad on Instagram as well. His handle is at
There's a
Ruffin.
contact me form on the webpage. You can contact me through that, or you can directly email me.
Awesome, great.
I keep the page updated every couple of days. I don't think it's really necessary to do that more. So I haven't updated it since the 23rd, but I will soon.
Thank you, Dr. Chad, for that really informative session. We're really grateful to your knowledge. Thank you so much.
Welcome. Y'all take care.
Let me